Hello, I'm going to talk to you about your upcoming anterior hip replacement surgery. I'll cover what the surgery involves, what to expect during your recovery, post-operative care, and the potential complications that can occur afterward. The hip joint is a ball and socket joint. The top of your femur, thigh bone, and the pelvic cup are both covered with cartilage, which allows smooth movement. However, as arthritis progresses, this cartilage wears down, leading to painful bone-on-bone contact and the formation of bone spurs. Here's an X-ray comparison. On the left, you'll see a normal hip with good spacing between the ball and socket. On the right, the arthritic hip shows how the cartilage has completely worn away, resulting in bone-on-bone contact. In an anterior hip replacement, we use a minimally invasive approach, entering from the front of the hip. This allows us to separate rather than detach the muscles, which means a quicker recovery for you. During the surgery, we remove the arthritic bone from both the pelvis and the femur. We replace the bone with titanium implants, including a titanium shell in the pelvis and a titanium pin in the femur. These are then fitted with a ball and a lining to restore the function of the hip. Preparing your home environment before returning from hip replacement surgery is essential for a safe and smooth recovery. Start by removing any tripping hazards, such as loose rugs, cluttered pathways, and ensure adequate lighting in all areas of your home. This will minimize the risk of falls and other accidents. Additionally, make use of assistive devices like a two-wheel walker or cane to provide stability and balance while moving around, particularly in the early stages of recovery. Ensuring these safety measures can help facilitate a comfortable and secure home environment for your rehabilitation. Proper management of medications before surgery is crucial for a safe procedure. Patients should stop taking all supplements and vitamins at least 7 days prior to surgery to avoid any potential interactions or complications. Similarly, it is essential to refrain from using NSAIDs such as ibuprofen, Aleve, naproxen, or meloxicam for 7 days before surgery. For all other medications, continue as directed unless otherwise advised by the pre-admission nursing team. This approach helps in minimizing risks and ensuring optimal surgical outcomes. The day before surgery, it's essential to follow certain guidelines to ensure a safe and successful procedure. Avoid shaving your legs the day before or on the day of surgery, as this can cause skin irritation or small cuts that could lead to infection. Make sure to shower with Hibiclin soap as instructed to help reduce the risk of infection during the surgery. Also, do not eat or drink anything, including water, chewing gum, or candy, after midnight. On the day of your surgery, it is essential to ensure that all pre-surgical confirmations are correctly carried out. Your surgeon will meet with you to verbally confirm which extremity is to be operated on. This step is crucial in avoiding any confusion or errors. Additionally, the surgeon will mark the hip that is to be operated on with a visible mark. This marking process is an important safety measure to ensure that the surgery is performed on the correct side. These steps are in place to maximize the accuracy and safety of your procedure. Before your hip replacement surgery, you will be administered anesthesia to ensure you remain comfortable and pain-free throughout the procedure. 2 types of anesthesia are commonly used. Spinal anesthesia numbs the lower part of your body while sedating you to ensure you're asleep during the surgery. General anesthesia, on the other hand, will put you in a sleep-like state, unconscious for the duration of the surgery. The choice between these methods will depend on your medical history, your preferences, and your surgeon's recommendations. Physical therapy is a crucial part of your recovery process after hip replacement surgery. On the day of your surgery, a nurse will assist you in getting out of bed to prepare for your initial therapy session. This step helps you regain mobility and begin the journey to recovery. Your physical therapists will then guide you through exercises and movements designed to strengthen your muscles and improve your range of motion, ensuring you are prepared to go home safely. The focus is on helping you achieve independence in daily activities as quickly and safely as possible. Unfortunately, even the most minor of surgical operations carries some risk of complications occurring. Hip replacement surgery is very successful, and complications are relatively uncommon considering the complexity of the procedure. Most complications are temporary setbacks. You have about a 98% chance that you will go through the operation without some significant complication, which causes an ongoing problem. The most common complication is blood clots in the legs. The most serious complication is infection. The most important long-term complication is loosening or wear. To prevent blood clots, blood thinners will be given to you first day after surgery. Additionally, leg exercises are encouraged to prevent blood clots. Unfortunately, blood clots can occur despite all these precautions. As long as the clots remain in the legs, they are a relatively minor problem. Occasionally, they dislodge and travel through the heart to the lungs, causing a pulmonary embolism. The risk of deep infection in first-time hip replacement is currently reported as being about 0.5%. Superficial redness or wound issues are more common and usually resolve quickly with antibiotics. You'll receive antibiotics before and after the surgery to help prevent infections, and you'll continue taking them for a week after surgery. Patients who have had joint replacements must take antibiotics by mouth before any dental work for 2 years after their hip replacement and must have all infections vigorously treated. Bleeding is another potential issue. Bleeding is minimized during surgery with anesthesia and IV medications. Sometimes bleeding can cause a hematoma, which is a collection of blood under the skin, but this often resolves on its own within 4 to 6 weeks. Small fractures can also occur during the procedure or if you fall shortly after surgery, which may require additional treatment. Some fractures may require treatment with a circlage wire placed around the femur bone. Other fractures that can occur after surgery from a fall may require further fixation in the operating room with plates and screws. A hip dislocation occurs when the head of the thigh bone or femur slips out of its socket in the pelvis bone. In the first 6 weeks after the surgery, the ball is only held in the socket by muscle tension. During this time, before scar tissue forms around the ball and before muscle strength returns, the hip is more likely to dislocate. Dislocations are possible, but less common with the anterior approach because we don't cut through the muscles, which helps keep the hip stable. Initially, the hip is more prone to dislocation until scar tissue forms and muscles regain strength, but precautions are not typically needed after this surgery. Loosening of the prosthesis is a potential long-term issue. And loosening depends on factors like the quality of your bone, how well the surgery was done, and how active you are. Hip implants are designed to allow for bone ingrowth onto the surface of the implants, thereby creating a permanent bond between the implant and your bone. Modern implants are designed to last a long time and are available in a variety of sizes and shapes to accommodate different anatomies and sizes. After surgery, you might notice that your leg feels longer. This feeling should improve within a few months. This is because your arthritic hip was likely shorter before the procedure, and we aim to restore it to its original length. Sometimes the leg will be deliberately lengthened in order to stabilize the hip or to improve muscle function. During the surgery, we obtain X-rays of both your hips. This is done to confirm proper implant placement and correction of leg lengths. Hip replacement surgery is highly effective at reducing pain and improving mobility. The completeness of the pain relief and the degree of mobility is partially determined by your hip problem before surgery. While it's rare, complications like nerve or artery injury can occur. Nerve injuries usually improve over time. Most patients experience some numbness around the incision, which generally decreases with time as well, though may not completely resolve. Anesthesia-related complications are also rare, but your anesthesiologist will explain the risks before the surgery. For a smooth and optimal recovery after hip replacement surgery, it's important to adopt daily habits that promote healing. Staying active with light exercises helps maintain mobility and prevent complications. A balanced diet rich in essential nutrients supports your body's healing process, while staying hydrated keeps you well-nourished and reduces the risk of complications. Additionally, adhering to your medication schedule and attending follow-up appointments ensures that your recovery is closely monitored and any issues are promptly addressed. After hip replacement surgery, it is important to follow specific guidelines to ensure a safe recovery. Initially, you will use a walker for protection, typically for the first 1 to 2 weeks, depending on your progress. Full weight bearing on the operated leg is usually allowed immediately, but always follow your healthcare provider's instructions. It is crucial to avoid high-impact activities like sports, using exercise equipment, or lifting weights until you receive clearance from your surgeon. These precautions help in protecting the surgical site and promoting a smooth recovery. Ice reduces swelling and inflammation, helps manage pain by numbing the surgical area, and promotes healing by improving circulation. To use it effectively, use an ice pack or cold compress. Place a thin cloth or towel between the ice and your skin to prevent frostbite, and apply ice for 15 to 20 minutes at a time, several times a day, especially after physical activity. You want to ice immediately after surgery and during the first few weeks of recovery, after physical therapy sessions or any increase in activity, and whenever you experience increased pain or swelling. Avoid applying ice directly to the skin. Do not use ice for more than 20 minutes to prevent skin damage. After your hip replacement surgery, you will have a waterproof dressing applied to your operative hip. This dressing is designed to protect your incision and allow you to shower without worrying about water exposure. It is important to keep this dressing on for the full 2-week period to promote proper healing and prevent infection. At your first post-operative appointment, we will carefully change the dressing for you. This appointment is also an opportunity to check the incision site and ensure everything is healing as expected. Maintaining the integrity of your dressing is crucial for a smooth recovery. If you notice any issues with the dressing or have concerns, don't hesitate to contact our office. 1 week after your hip replacement surgery, you are allowed to shower, but it is essential to keep the watertight dressing in place to protect your incision from water exposure. However, it's crucial to avoid submerging your surgical wounds in water for at least 4 weeks after surgery. This includes baths, swimming pools, and hot tubs. Submerging your wound could increase the risk of infection and delay healing. Managing pain effectively at home after hip replacement surgery is crucial for a smooth recovery. It's advisable to take pain medication with food to help reduce nausea. Taking your medication before bedtime can also help you sleep better. Remember that pain medications usually take 30 to 45 minutes to start working, so it's important not to wait until the pain is severe to take them. Understand that these medications may not completely eliminate all pain, and it is okay to experience some discomfort as part of the healing process. Weaning off narcotic pain medications is a crucial part of your recovery after surgery. Prolonged use of narcotics carries several risks, including dependence and other side effects. Therefore, most narcotic pain medications will not be prescribed after 6 weeks post-surgery. It is important to create a plan to gradually reduce the use of narcotics. Work closely with your healthcare provider to manage this process, ensuring you transition smoothly and maintain adequate pain control during your recovery period. Nausea and vomiting are common experiences following surgery due to anesthesia and pain medications. To manage these symptoms, take small sips of clear fluids and eat light meals, avoiding heavy or greasy foods. Resting in an upright position can also help alleviate nausea. To further manage nausea, post-operative medications will be prescribed. These medications are designed to reduce the likelihood of nausea and vomiting, ensuring a more comfortable recovery process. Constipation is a common side effect of pain medications often used after surgery. To help manage this, a stool softener will be prescribed to ease bowel movements. Additionally, consider using over-the-counter laxatives, eating a high-fiber diet, and drinking fruit juice to promote regularity. Taking these steps will help minimize discomfort and promote a smoother recovery process. After surgery, most home medications can typically be resumed unless specifically instructed otherwise by your healthcare provider. This includes any vitamins and supplements that were part of your routine prior to surgery. It's important to follow the guidance provided to ensure a safe and smooth recovery. The primary goals of physical therapy after surgery are to restore mobility, enhance strength, reduce pain and swelling, prevent complications, and promote independence. Therapy generally begins 3 weeks post-surgery, allowing initial healing and enabling gradual strength and mobility building. Following these objectives ensures a safe and efficient recovery, enabling you to return to daily activities promptly. Returning to driving after surgery requires careful consideration of your safety and healing status. While on narcotic pain medications, driving is strongly discouraged due to their impact on your alertness and reaction time. Additionally, if you experience pain in your hip while driving, it may be a sign that further recovery is needed. Typically, patients can expect to return to driving within 2 to 4 weeks, but always consult with your healthcare provider before resuming driving. After your hip replacement surgery, it is crucial to monitor your recovery closely. There are specific signs that may indicate complications or concerns that require immediate medical attention. For example, a fever above 101.5 degrees Celsius could suggest an infection that needs urgent care. Similarly, if you experience excess pain or swelling in your calf, this may be a sign of a blood clot. Additionally, any significant drainage from the surgical incision or redness around the incision site could indicate an infection. It is essential to call our office right away if you notice any of these symptoms, as early intervention can prevent more severe complications. Your health and safety are our top priorities, so don't hesitate to reach out if you have any concerns during your recovery. It's important to attend your scheduled post-operative appointments to ensure a smooth and healthy recovery. Your first appointment will be 2 weeks after surgery to assess your early healing and check your incision. This visit allows us to address any immediate concerns and guide you through the next phase of your recovery. Your second appointment, typically at 6 weeks post-surgery, will evaluate your progress in greater detail. We'll discuss how well you are adjusting to your new hip, assess your range of motion, and answer any questions you may have about your recovery or physical therapy regimen. Please mark your calendar and feel free to call our office if you need to adjust your appointment times. Major surgery is not without risk. There are risks in everything we do in life. Our medical staff will do everything we can to minimize the risks that you undertake. The worse your preoperative symptoms are, the more reasonable it is that you take the risk inherent in having a hip replacement. Remember that the main goal of your hip replacement is to improve your quality of life. We look forward to helping you through your upcoming hip replacement surgery. Hopefully, this presentation has given you more insight about your upcoming surgery.